Hi, my name is Ken, a third-year PhD student from the University of Tokyo. Today, I'm excited to share our work as ears, designing and evaluating the user experience of wearable assistive devices for single-sided deafness. This work was done in collaboration with the University of Tokyo Hospital and Carnegie Mellon University. There are about 1% of the population with single-sided deafness, being deaf in one ear, including myself. People with SSD have three major challenges in their daily lives: difficulty hearing sounds from the deaf side, difficulty hearing in noisy environments, and inability to tell where a sound is coming from. These functional disabilities of SSD restrict social participation in hearing and speaking cultures. To cope with these challenges, hearing aids for SSD exist. They are called CROS hearing aids. They reroute the sound coming to the deaf side to the hearing side by putting the ear tips inside the ear canal. Although they are shown to improve quality of life, its usage rate is only 4%. However, very little is known about why people with SSD, in particular, use hearing aids less compared to who are hard of hearing in general. Therefore, the purpose of this study is to design and develop a device with better effectiveness, wearability, appearance, and social acceptance to increase the acceptance rate. We also explore the difference in user experience over time between those who accept the devices and those who don't, to explore the bottlenecks toward accepting the device to pave a path to design future assistive devices for SSD. Recruiting enough participants with SSD is difficult. Therefore, we built a community for SSD who are interested in solutions for SSD through our website and kept in touch with more than 50 individuals with SSD over several years and conducted this research with them. To design a more accepted device, we conducted a background study, which was an online questionnaire with 51 people with SSD. From our background study, we identified several key takeaways that design our design process for asEars. Hearing from the deaf side was the most mentioned difficult situation. The participants also expressed a strong preference for a comfortable, non-intrusive device that could be easily integrated into their daily lives. They also emphasized the importance of the device's appearance, as many were concerned about the social stigma associated with traditional hearing aids. Based on the background study, our team, including 2 members with SSD, went through 3 iterations developing a device and developed asEars, a bone conduction assistive device for people with SSD worn with eyeglasses. As you can see from the video, asEars is attached to a pair of normal eyeglasses. asEars collect the sound from the deaf side with a microphone and transmit to the hearing ear with bone conduction. asEars was adjusted to match the sound from the speaker at both the hearing and deaf sides by measuring the sound inside the ear canal of the better ear using a microphone. The measurements confirmed when the sound came from the deaf side, the sound was boosted in the hearing ear, from the yellow line to the orange line. We had 2 research questions and performed the user study to answer them. The first question was, what factors influence the acceptance of assistive device for SSD? We employed 7-point Likert scale questionnaires to answer this question. The second question was, how do different phases of user experience affect acceptance of assistive devices for SSD? We collected diaries with user experiences related to the devices. For the user study, 10 participants used CROS hearing aids and asEars for 2 weeks each to answer questions in diaries daily. Regarding the first research question, previous work has discovered that performance expectancy, effort expectancy, social influence, and facilitating conditions contribute to acceptance. This model is called the Unified Theory of Acceptance and Use of Technology, UTAUT in short. UTAUT has been applied to investigate acceptance of assistive technology for visually impaired individuals. In this work, We adopted standard questionnaires to ask participants about the performance expectancy, effort expectancy, and social influence. Facilitating conditions were out of scope of this work since it is about customer support after buying hearing aids. As a result, regarding performance expectancy, effectiveness and naturalness influenced acceptance. Wilcoxon sign rank test with Bufferini correction indicated that both factors were significantly better for asEars. Regarding social acceptance, spectators analyzed the degree which the surrounding people believe that the person should wear a device influenced acceptance. This was also better for asEars. Regarding effort expectancy, usability influenced acceptance. This was better for CROS hearing aids. We measured the degree of acceptance by total satisfaction, and asEars was significantly better than CROS hearing aids. Please see our paper to see the actual questions used in the questionnaire and for quantitative results. For the second research question, phases of user experience affecting acceptance. A study on iPhone found that user experience of products consists of 3 phases. First is the orientation phase. There are 2 types of user experiences in the phase, learnability and stimulation experiences. The second phase is the incorporation phase, which consists of user experiences such as usefulness and long-term usability. The third phase, identification phase, consists of social and personal experiences. Social experiences relate to how the products stand in their daily social life, and personal experiences relate to how the products blend in their daily lives. We apply this framework and investigate how different phases of user experience led to acceptance of assisted device for SSD. We first divided the participants into 2 groups, participants who accepted both devices and participants who rejected either device. They are separated in the first row and the second row. For the orientation phase, a sharp decrease of dissatisfying experiences led to greater acceptance. In the incorporation phase, satisfying experiences were sparse for people who rejected the devices. In the identification phase, almost no satisfying experiences were reported by people who rejected the devices. From the semi-structured interview after each 2 weeks of device usage, we drew 2 major implications for designing a more acceptable assistive device. First, users can wear assistive devices with their favorite items. 2 participants mentioned that CROS hearing aids could not be used with their earbuds they use every day, and taking off hearing aids to wear their favorite earbuds were cumbersome, making them reluctant to wear the hearing aid. On the other hand, they had a comfortable experience being able to use their earbuds while wearing asEars. Second, users get an opportunity to disclose their disabilities by making the device visible without evoking the disabilities explicitly. Because asEars did not look like a conventional hearing aid, many curious people often asked what the device was. The participants pointed out that when it is difficult for them to disclose they have the SSD, the device being mentioned by the other person creates an opportunity to disclose their disability. In this way, asEars made it easier for the other person to ask about the device because, unlike conventional hearing aids, the other person did not assume that they were hard of hearing, and there was no fear of saying the wrong thing when talking to people with disabilities. One limitation of our work is that participants reported fewer experiences over time, although we created an incentive to report more experiences by providing extra compensation. In future work, a 2-stage approach can be taken to conduct a longer experience with richer data. First, conduct a full questionnaire to extract critical factors for acceptance in the short term, like 1 week. Then compress the questionnaire to reduce participant load and gain high-quality data over several weeks or months. Throughout the study, we found comfort, usability, and appearance issues with asEars, so we plan to improve the device and make it globally available for people with SSD. Here is a summary of this presentation. Thank you for your kind attention.